Hi, everybody. Hi, this is Dr. Ken Muich calling. This is number 54 presentation, as a matter of fact, for our live video presentation. And today we got a very, very interesting subject again, of which we always seem to have, as far as I'm concerned. It's called a pain solution, or a very, very common problem, and that is with pain. What are you going to do with pain? How do you deal with it? In the United States alone, there's over 100 million people that are suffering from chronic pain, believe it or not. And we're going to get into some definitions in just a few moments. There's over 100 million U.S. citizens, like I say, that are suffering chronic pain. The majority of them being women. That's at least based upon research. And medications seem to be just a temporary relieving situation that often leads to addiction. So that's not good. The problem with many of these chronic problems is that doctors don't have the time, nor do they listen to patients that have actually chronic problems. And that's a very serious problem because they have a difficult time differentiating some things from other conditions. If you have a chronic pain problem versus one that is caused by a specific incident, or say, for example, things that they can have, they can prove by objective testing, such as, say, for example, diabetes, high blood pressure, irritable bowel. Doctors, allopaths, we call them, MDs, DOs, so forth and so on, medical staff, they're trained by objective testing to help diagnose an individual problem. I've mentioned this over and over again. So what we're trying to deal with here is trying to change a mindset. Look, if you have objective tests and they don't come out positive. Now, what are objective tests? As I mentioned before, objective tests are those things that they can measure, like blood chem, urinalysis, CBC, x-rays, MRIs, CT scans. All of those things are objective tests. But if you come into a doctor and just have chronic pain all over your body, or indiscernible, so forth and so on, they have a difficult time diagnosing that, especially if those objective tests turn out to be negative. What is a negative test? Well, that's when it comes back and it says it's normal. I can't understand what the problem is, why this person's having this problem. So you have a problem as far as medications are concerned, and the problem is a domination of opioids. Between 1999 and today, 2019, over 200,000 Americans have died from overdoses of opioids or abuse of opioids. Over 200,000. In 2016, the Center for Disease Control Prevention, not the FDA, okay, not the FDA, which you would think should have really control over certain things that are being used. But this disease control established new guidelines for doctors to use for the distribution of opioids. That's 2016. And I know almost everybody here has seen reports or been subject to, family members and so forth, from opioid problems. And believe me, it is a very, very serious problem, the excess amounts of opioids that are out there. Mayo Clinic, this is based upon, I'm going to be talking to you about a paper, a report in a paper that was just completed February 2019 by Mayo Clinic. Got that one? Mayo Clinic. The Mayo Clinic says you can't make pain go away completely. They can't make it go away completely. So you have to learn to cope with it through pain rehabilitation centers that they're establishing. That's their answer, okay? So they focus, the focus is on not reduction of pain as much as to live life with reduced pain, despite pain, so to speak. How? That they're suggesting is certain things like, not medications, but like yoga or Tai Chi or exercise programs or muscle relaxation sessions, biofeedback, meditation, group therapies, all those different things that they're suggesting. Because they said in this report here, right here, in this report from Mayo, there is no cure for chronic pain and the risks associated with all of the medications that people are taking. Because, as I mentioned before, all pharmaceuticals have side effects, especially the stronger the medications and so forth that you take, the more serious the problems are. If you don't believe me, just watch TV for about a half an hour, and you got about half an hour different um, medications that come on that they're trying to sell you for everything from skin rashes to you name it. And if you don't listen to the side effects, I'm telling you, that's the most important thing. As they're having people have fun and laugh and run through flowers and play with dogs and so forth. In the meantime, the medications are killing people. So anyway, that's a real problem, and Mayo is trying to answer that problem because of certain things that you need to know, and that is that they don't have an answer for your pain problem. Well, one of the main things is that doctors aren't listening, and we're going to get into that also in just a few moments. So, but let's look into this a little bit more detail. What is pain? Well, you have really two major types. You have acute. Now, acute pain is usually specific, dynamic, usually brought on by either a trauma, auto accidents, slips and falls, or some form of illness, so to speak. So you know that where the problem is at. And it usually doesn't last very long. Oftentimes, it might last for a couple of weeks, maybe a month or so, depending. Actually, a little bit longer if it's an accident, because you have, especially if you're going through therapy, which you should, you get through proper therapy to reduce the adhesions and scar tissue that lead to further problems later and additional pain if you're being taken care of properly. So the acute pain is pretty specific in that respect, and it doesn't last that long. That versus chronic pain. So chronic pain is a little bit different. It usually lasts for more than 2 months and 2 to 3 months, and it can last for years. Okay, once it gets to that point where the pain is extensive and lasts for longer periods of time, it is considered by the Social Security Department and workers' compensation to be a chronic problem, and so you're treated totally differently from that. Now, chronic pain can be mild, moderate, or severe, and again, chronic means long term, and that's a real problem. Now, acute, again, as I mentioned, you know exactly where it's at. It's in the knee, it's in the shoulder, it's in the neck, from a trauma or whatever else, or from an illness or disease, whatever it might be. If it's osteoarthritic, if it's rheumatoid, whatever. It usually is a specific joint or joints and so forth, and they can usually deal with that. Chronic can be any body part, and oftentimes it moves around to different body parts, such as fibromyalgia, okay, or headaches. Headaches are broken into a variety of different ones, but you can have just a general headache, cluster headaches, you can have migraine headaches, so forth and so on. So they do have different certifications, classifications for headaches itself. Irritable bowel, okay, abdominal pain, or general pain in itself. Like, again, fibromyalgia or many of the other ones. You have MS and you have lupus and a variety of other conditions that can actually traverse and go in different parts of the body. So this general pain area is kind of a problem as far as taking care of this individual as far as their problems are concerned. So get an idea as far as acute versus chronic. Now, the nervous system itself is like a transit system, okay? It's a communication system. It starts with the peripheral nervous system. That means that it's throughout your whole body. Matter of fact, if you take everything off your body, everything from skin and organs and everything else and bones, you wouldn't be able to look through your system because of all the nerves. It goes all the way to your fingertips, all the way to your toes, and in organs, in joints, around bones, like I say, various body parts and so forth. So this peripheral nervous system is sensitive to various things that happen to your body, especially pain, such as from cuts, from falls, from inflammation, from pressure points, from excesses in hot and cold, skin problems, all sorts of different things that it can go from. So this peripheral nervous system, let's say you cut your finger, okay? Or it could be a knee or whatever else. All right, it transmits information to the spinal cord directly to the brain, and then within literally a blink of the eyes, bang, it comes back to wherever that problem is at. If it's a finger or knee, whatever else, so forth and so on. So that's that rapid transit system, that communication relay system. It goes from one area to another, but it's not slow. It's one of those things that bing, bing, bing. It happens so fast oftentimes, you don't even realize it, that it's happening. And that's where you get your pain centers from. Now, research and more research. Okay, I love this. I don't know who did this research, but research says that if you're unemployed or if you're poor or you have lower education, you will have higher pain levels than other people. 30 plus years of experience. I'm sorry. The various letters I'm going to use usually start with BS. I don't know where they got this research from, but when pain is evident, it's pain, okay? There are certain things that can transmit over. Let's say you lose your job and you're in pain. That's stress, and I'm going to talk about that in just a few minutes. That stress will actually add pain, which adds stress, which adds pain, so forth and so on. I can understand that. Just because, you know, you maybe not making as much money or whatever, that has never in my clinical experience, okay, ever come to the forefront. And all of my experience is from reading reports, evaluating, and clinical experience, okay? The clinical experience is probably more important than any research. Why? Because I'm the doctor in the field. I'm dealing with people on a day-to-day basis, not trying to write reports and so forth and papers on some experimental things that are going on. Yeah, research is important. It is, okay? Research is very, very important. It validates, actually, what we're doing. And I would never use something that was not research valid. But just to make statements like these things are, I think, a little bit far-fetched. Now, there's health problems from chronic pain. And the health problems are very, very subtle sometimes. You don't even realize it. If you have chronic pain for more than a year, actually you start losing gray matter in your brain, as much as 5% per year, which is actually going to lead to Alzheimer's. So it's very, very important that you deal with this chronic pain, and we have to find answers. And again, we're going to get to that in just a few moments. So chronic pain actually causes the loss of gray matter in the brain, which actually can lead to, again, Alzheimer's. A second thing, when you have chronic pain, whatever condition it is, oftentimes you slow down and you can't do the things that you wanted to do. You're not as active, okay? You're not exercising as much as you did in the past. If you're not exercising, from 1 year to the next, you can again lose anywhere from 2 to 5% of your lean tissue, muscle tissue, that turns to fat, believe it or not. So lack of activity, even if you're the same weight last year as this year, if you don't exercise, you will have your lean tissue turn to fat, as much as 5%. And why is that important? Because that fat is inflammatory, and that's going to add on to your pain. So lack of activity and exercise is not any good for anybody, that's for sure. And so that leads us to another area, and that would be dietary, which we've talked about before also in the past. Now, because of this physical deterioration and so forth, you can actually have some additional problems. Loss of sleep is one important thing because of chronic pain. And research has shown loss of sleep can lead to a variety of different health problems, again, including Alzheimer's. Again, I talked the stress-pain-stress relationship. That's important. And, of course, depression. When you have long-term pain, people get extremely depressed. I know when I work with fibromyalgia patients, the depression of them, first of all, not knowing what they have, and then second, finding out what they have and having doctors telling them, we don't have an answer for you, but here, take this medication, is just as depressing as anything that you could find in the world. So, and then we have another problem as far as the chronic pain, and that is dependency on medications, which leads to addiction, which again can lead to additional health problems and oftentimes death from improper usage. And another thing from long-term chronic pain, it's called hypersensitivity denervation. Hypersensitivity denervation is very, very interesting. Your nerves, if they stay sensitized for a long period of time, become so sensitized that they become overactive, oversensitive. Light touches, for example, can cause pain. All of a sudden, you'll have jerking responses of pain from nowhere, from no response whatsoever. So this hypersensitivity denervation is another problem that people have as far as chronic pain. So what are you going to do about this pain? Well, first of all, the acute pain from an injury, trauma, illness, so forth, again, can be taken care of, with proper treatment. In our clinic, obviously, we do chiropractic, we do physical therapy and modalities, acupuncture, a variety of different things that normal physical therapy would take care of, along with additional items in itself. And we take care of patients so that we get them back to as close a state as normal. You know, there's certain things that we have as far as in therapy is concerned that a lot of people don't even use. There's something called Russian stim. Russian stim was developed by the Russians for their athletes to remove scar tissue and for the allowance of regular connective tissue to replace the scar tissue. It doesn't have to be a new injury. It can be an old injury. And it works. It works like a charm. It doesn't take forever either. Another thing is that we do in our clinic with all patients, whether they're fibromyalgia or otherwise, is we take the time to find out what the problem is and what the cause of the problem is. So every patient that comes in, we sit down, we talk to them, we spend very good, knowledgeable, educational time learning as much as we can about the patient, rather than just running them through like, oh, well, you got a headache, okay, take this medication, whatever, boom, boom. That's not us at all. The most important thing is finding a doctor that will sit down with you, talk to you about your problem, and express some knowledge and interest in your condition and your problem. That runs a big difference as far as just running you through and just guessing or assuming certain things without really finding out about the patient and what their problem is. We've had a lot of patients that come in with chronic pain, chronic problems that we've taken care of. If you take the time to listen to the patient, believe it or not, patients are very, very interesting and they're very knowledgeable about their problem, rather than as a doctor assuming certain things. And you know what that word assume means. Okay, you have to find a doctor that'll take the time to listen to you and find out what the problem is. That makes a big difference as far as not only your acute pain from traumas and injuries, but also chronic pain. I'll tell you, it makes a world of difference from our patients because they know they're being taken care of properly. So I don't know where Mayo got this information. I just think that they have too many patients and not enough doctors, and they have to run them through quickly without really taking the time to find out what the problem is. That's my honest opinion, and that's my honest clinical opinion based upon 33 years of working with patients in our clinic. I want to thank you so very, very much. Hope it didn't take too, oh boy, it took almost 20 minutes, but I think it was well worth it, especially if you're in pain. If you got a problem, you have pain, let us know. We'll do everything we possibly can to help you. And if you want someone that can come and talk to you about different subjects, I am open and available to come to your groups and talk to you, especially local, long-term or distant-wise. Maybe we can work something out, or I can actually do a video on it. Thank you so very, very much. Again, this is Dr. Ken Muich, Stetson Chiropractic Clinic and the Fibromyalgia Wellness Center. We're always glad to see your back and other body parts. Next week, we're going to be talking about another pain situation that I think we find very, very interesting. And the subject is reflex sympathetic dystrophy. Reflex sympathetic dystrophy. It's a condition with a lot of pain and a lot of question marks. And so we're going to cover that next Monday, 12:30 p.m. And you have a wonderful week and enjoy. Thank you so very, very much. Bye-bye now.